Hello, everyone. Good afternoon. I'm Dr. Olu Akinremi, Senior Transformation Program Lead within Adin and James CSU. Thank you for joining us today. We're excited to share with you the progress that we have made so far on the Net Zero tool that we showed you November last year, how far we've gone with the tool. Now this tool will help NHS organizations meet their NHS Net Zero compliance, reporting and assurance responsibilities accordingly. And just as a starter, if we don't mind, if we just put maybe in the chart, maybe our roles or positions, and maybe the organizations we represent in terms of maybe the trust or the private, the third sector, primary care, social care in the chart. That would be very helpful. ICB, local authority, just a short description in the chat, that would be very helpful. Thank you. And just to say, we are part of the NHS, and we work collaboratively with NHS organizations to deliver value-adding back office services, and we provide clinical and transformational support for NHS organizations. So these 4 CSUs we have full national coverage, and we are aligned with every integrated care board and NHS England regional office across the country. So we are designed to support NHS England and local NHS bodies in achieving their various ambitions and priorities. So just as an icebreaker to start this off, just a quick, Claude, if you want to put that in the chat, please, that would be very helpful. Just a quick poll to get us started. It should appear on our screen right now. So given the current pace of NHS decarbonization, how likely are we to reach net zero by 2040? So I would like everyone to submit their vote, and we'll just see the results before we keep going. Yeah. I think C is still taking the lead now. Most of us are saying unlikely. So between B and C at the moment. Yeah, polling 70%. We have about 25 people on the call. If you could all participate, that would be very helpful. We've got 13 responses so far. We encourage everyone to participate as much as possible. We still got only 15 responses so far. Thank you, everyone. I think we have a few saying very unlikely, and some saying unlikely, and some somewhat likely. 26 of us on the call, 17 responses. We're almost 100%, almost there, getting closer. 60% of us have voted. We encourage others to please submit their responses too. Good. Yeah, we encourage others to continue to submit their responses as to tracker. So let's have your review of this now. So out of 20 responses, we've got about 55% saying unlikely. And just to do a poll review, yes, I think they're right. No, it reveals it is quite unlikely that we achieve if you keep going at this way without making any sort of intervention or doing something drastically. So the poll reveal is actually correct. The current NHS efforts will meet the 2040 targets without stronger interventions in place. So this chart that we just in here just shows us, gives us that aha moment, underscoring the urgency for real-time data tools, more aggressive sustainability measures, and enhanced regulatory and operational changes that we need to put in place. So the key takeaway is that we must take decisive action now to close the gap and reach net zero on time, or for the targets that have been set. Yeah, thank you everyone for participating in the poll. And so as we continue, we know that climate change is an urgent threat, that the WHO projects will cause additional 250,000 deaths each year by 2050. So for us, this isn't just about the environment. It directly impacts patient care. And that's the reason we have built this through. And as part of the NHS, we have a responsibility to respond quickly. Through data-driven strategies, we can reduce our carbon footprint, protect patients, and help secure a healthier future for everyone. So the NHS set out on July 2022. The NHS made a historic commitment by enshrining Net Zero targets into law through the Health and Care Act 2022. So we aim to achieve net zero emissions, Scope 1 and Scope 2 by 2040, and net zero influenceable emissions, Scope 3, by 2045. The Delivering Net Zero National Health Service report is the vehicle that we are trying to do roadmap for this journey to take place. By integrating sustainability into every framework of our operation, we are protecting patients, we are protecting our healthcare, and we're trying to build a healthier future for everyone. And just to go deeper in terms of the emissions, so Scope 3 emissions can be up to 11 times higher than Scope 1 and Scope 2 combined, making up for as much as 60 to 80% of the NHS total carbon footprint. So this includes indirect emissions across entire supply chain. So everything from purchased goods to patient transport, tackling Scope 3 is quite key. So meeting net zero goals requires strong collaboration with suppliers and innovative approaches to care delivery. So by focusing on these broader, often hidden emissions, we can make the biggest impact on our journey to net zero. And just to say, this provides us with a problem and also an opportunity. This chart just shows a significant proportion of the NHS carbon comes from medicines, medical equipment, and the broader supply chain, areas we can influence directly through smarter procurement and innovation. However, by viewing this both as a problem and an opportunity, we can embrace the healthcare without harm approach. That means rethinking care pathways to reduce waste and emissions while maintaining or even improving patient outcomes. So ultimately, this is about delivering high quality care in a way that supports both human health and the health of our planet. So there's an upward trend in reporting obligations right now, as we know, following the objective. So as the NHS expands its sustainability efforts, more organizations are now required to meet rigorous reporting obligations. So through various streamlined energy and carbon reporting to mandatory carbon reduction plans, the focus has shifted from just simply planning to now delivering tangible results for sustainability. So these frameworks foster transparency and accountability, aligning the NHS with net zero goals and driving meaningful reductions in emissions. So it's about moving beyond commitments and really showing measurable progress for a healthier future. And also the Green Plan supports this as well. Now, which the NHS now requires every trust and ICB to develop a robust green plan, complete with clear board level accountability. Key elements include a strategic roadmap with measurable targets, digital integration through tools like the tool we are going to showcase today, and embedding sustainability into procurement and operations. By placing these sustainable practices at the heart of the NHS, this latest green plan reinforces our commitment to protecting both patient health and the environment. So how do we ensure accurate carbon reporting? It's been a challenge for most NHS organizations, and it is essential for us to achieve this net zero mission. So when reporting falls short through errors or misrepresentation, there could be risk of fines or reputational damage, or a loss of public trust. It can also undermine investor confidence and staff morale, slowing progress towards all our sustainability goals. So by getting it right, we not only safeguard our financial health, but also strengthen our credibility and continue to lead the way in delivering a sustainable healthcare for future generations to come. So NHS organizations are grappling with limited time and resources for carbon data collection, often spending over a month on this particular process, collecting data. So many also lack many also lack in-house expertise, making consistent reporting a challenge. So as a result, nearly half of NHS but don't receive regular updates on decarbonization progress at all within their organizations. So addressing these barriers through better data systems, staff training, and cross-team collaboration is essential to meet the net zero targets and to deliver those sustainable, high-quality care that patients deserve. So, the current focus on gathering, reporting, and emissions data is consuming valuable time, as you can see by this chart, and resources, because this time could be better spent on actively reducing carbon output. So this framework just shows how we need to shift our effort from collecting information to implementing real-world solutions. So by streamlining data management and reporting, the NHS can free up capacity to invest in carbon reduction strategies and sustainable practices, ultimately accelerating our progress towards net zero. And this brings us to looking at the impact of the emissions as well. So if your NHS is struggling to meet the decarbonization targets, you are not alone. While the NHS aims to reach net zero target by 2040 and 2045 accordingly, only a small percentage of trusts are on track to achieve these milestones, as we've noticed in our poll earlier. So most face operational, financial challenges in cutting carbon while maintaining quality care. But by working towards incremental changes in procurement, energy use, and service delivery, we can collectively accelerate towards a net zero future. So next, I think there's a quick interactive poll again before we go to the next bit of the question. So which element is most critical for transforming NHS sustainability ambitions into measurable, actionable outcomes? So Claude, if you want to put that in the chat, please. Please, we encourage everyone to participate in this poll before we go into that. So which element is most critical for all these options for transforming NHS sustainability ambitions into measurable and actionable outcomes? Please cast your vote using the polling tool that has appeared on our screen. Thank you. As we participate, I think we have 16 responses out of 30. We have about 60% votes. So 10 more responses to go. And we have our results. Yeah, I think we have 23 responses. For the sake of our time, maybe I'll just stop the poll there now. So we have here D taking the lead, that's about 52%. And we have half that B, digital integration and real-time data tools. I think from the question, it says which element is most critical for transforming NHS sustainability into measurable, actionable outcomes? Yeah, I think I will review the poll now. In as much as other options may be correct, I think for you to have that measurable outcome, we need data tools, we need digital integration and real-time data tools to do this. And it is just the linchpin that converts big sustainability goals, those transformation plans, into real measurable outcomes. Because without accurate, continuous tracking of emissions, even the strongest green plans can fall short. And real-time data tools give the NHS the ability to spot inefficiencies, adjust strategies quickly, and ensure every decision is backed by evidence. So this digital backbone is vital for transparency, accountability, and ultimately accelerating our journey to net zero. Yeah, thank you everyone for participating in that poll. Yeah. Yes, I've seen the comments in the chat. I think, yeah, there are a lot of things that work. All of those options are correct, but I think for us to measure it, I think we need those tools. But we'll take questions at the end as well. So just to go on further, what is the tool we are trying to showcase today? It is a net zero health and care pathway tool built on an enterprise platform designed to decarbonize clinical pathways and also to look at even individual sites. I call it horizontal and vertical, and also serve as an intelligence platform for capturing and preparing annual carbon reduction plans and sustainability plans. So it measures and tracks carbon outputs across entire patient journeys, modeling different interventions to highlight their impact. So it's got real-time dashboards, emission factors, and carbon input analysis. It offers actionable insights for diverse healthcare settings. By aligning clinical decision-making with sustainability goals, this tool empowers the NHS to deliver quality patient care while cutting emissions. And it goes through from community and primary care all down to outpatient services. And what makes this tool unique? It stands out for its data-driven design, financial integration. We had the cost of each clinical pathway integrated into the tool, so you can visualize your carbon output and also the cost of those activity. And it has this patient-focused approach as well. And it captures comprehensively procurement, medicines, treatment, building, equipment in all of this approach as well. So it supports both the vertical exploration, that is digging deep into looking at your site, or looking at I call it the horizontal, looking at different clinical condition pathways. And you can have comparison of emissions across different clinical pathways or across different organizations. So this dual analysis makes it a very powerful tool, and it provides you with immediate, clear, actionable insights where your carbon hotspots are, and you're able to make decisions in favor of the environment or in favor of your resources. And it makes it easier to align clinical care with decarbonization goal and just have those trade-offs, those multi-benefit trade-offs at an instance. So how does this support the NHS? So in the face of limited time, budget constraints, and inconsistent sustainability data, our fully managed net zero carbon survey helps streamline the NHS path to net zero. So by combining leading decarbonization expertise with comprehensive data collection, we make it easier for NHS teams to accurately measure emissions and also set clear reduction plans and targets, and therefore effectively manage their resources as well. So this simplified approach to carbon reporting ensures NHS stays on track to meet the net zero targets by 2040 for direct emissions and 2045 for the scope 3 emissions. So I will pause here for a moment, then I'll go into the tool proper. We've got a YouTube link in the chat that's been shared with everyone. So I'll stop sharing my screen for a moment, then I'll go into I would like to do a live demo of the tool. And we can also watch the video, YouTube video link after the call. Yeah, just a minute, thank you. Can everyone see my screen? Yeah, thank you. So this is the platform. It's called Anaplan. It's a cloud computing platform, and it's an enterprise planning management platform where we build a net zero tool. So this is the assessment page. I'll go to the landing page. The landing page just shows you, we've written the description, the purpose of the tool, and the different administration, the different sections of the tool. You see that on the landing page, and various instructions to follow for the end users. But for the purpose of this demo, I would like to just go to what you do to create an assessment. So at the very part of the, you're able to look at your region where you are located around the country, and you choose your region accordingly. Also, you're able to choose your organization, ICS or ICB accordingly, then the provider type that we have as the organization. And also, you can also look at provider name and click on it to set up your organization. And also, you can now look at your clinical condition pathways. We have some examples here that we have set up as well. So you can click here, your pathway, name your pathway, create your pathway accordingly, and it appears in this list. And you can do that for all organizations that you have chosen at the top of the screen. And also, you're able to put your number, the number of patients in different clinical pathways in there. Another thing we have done is across those different clinical pathways, you're able to see where what your pathway influences, whether it's secondary care plan, ambulance, emergency, primary care, or even beds occupied or continuing care. And if you're looking at your site, instead if it's by site, looking at your ward or you're looking at your emergency, you can create also the same way you create your pathway. You can look at your a particular site and create within your organization site. We just put site A to D there. After creating that site, you're able to now say, are you looking at your estates? Are you looking at your medicines? Are you looking at your supply chain? Are you looking at your travel and transport? Are you looking at your food and nutrition across that particular site that you have chosen? For the purpose of this demonstration, I'll quickly just go through the asthma pathway that we've created on the tool. So just to give us, you're able also to look at the emissions factors. What we've been in partnership with Mighty Energy and Sustainable Healthcare Coalition, we have an inbuilt default emission factor, and also Adin and Gem being involved in it, we also integrated the cost of those activities into the tool. But we've also given an option for each organization, if they've got their own manual emission factor, whereby they can input this, override our own default factors, and they have an opportunity to enter their own their own manual emission factors accordingly to have their bespoke carbon calculation. We've done this across the different sections of the tool. So you have a basic emission factors underpinning the calculations on the tool. So for the asthma pathway, we have 100 patients, and this is the total number of emissions for the particular year period. You're able to look at the different clinical pathway, the organization you've created right at the beginning. You're able to look at the different clinical pathways, also on the sites that you've created. You're able to look at it in total or in direct sections that you want to look at individually. And you're able to look at this on a monthly basis, quarterly basis, or an annual basis as well on the tool. So for the purpose of this presentation, this is the annual view. You have your total emissions of 100 patients with this number of emissions across, and also the total cost of those activities, and also the carbon intensity per patient for that particular pathway. And you have a breakdown across each of those sections as well, where that's, and you have a graphical representation of where you have your hotspots. And from this graphically, we could see immediately that secondary care is the main hotspot for this particular pathway. So that's your carbon emission summary. And after seeing your carbon emission, you're able to say, I want to do an initiative management. How do I implement an initiative? For example, an ambulance service could say, oh, I want to buy 50 new electric vehicles. They put in the name of the initiative, they put in the carbon factor for the new electric vehicles, and they're able to track the impact of those new electric vehicles in their fleet over time across those different areas, and monitor the impact on their and the cost as well over time. And also they're able to see where the hotspots are, how the trajectory is going over time with the various initiatives that we've overlaid. You see the impact of individual initiatives and the aggregate initiative over time trending towards net zero 2040 to achieve their net zero target. After creating your initiative, you can also have an overview. Let me see my sustainability plan. Is it working well? Am I on track to achieve net zero? Then you're able to see for this particular pathway, we can see that secondary care plan without initiative is giving us about 52,386 in terms of the GHG emissions. Whereas after implementing some innovation in the pathway, we have it reduced to about 26,000 after those initiatives. So all this you can track as a whole as you implement on the tool your various initiatives, and you can also track your cost as well. So you can make decisions for the decision makers. They can look at the cost or the impact of their emission factors. And to give an example of where costs, if you look at the various sections, you can look at, for example, maybe secondary care plan where you have surgeries, some particular trusts, they do have, maybe they use a particular anesthesia for surgery in Trust A, and Trust B, they use maybe desflurane and isoflurane. You can actually see the impact of using those and the cost of those anesthetic agents, and see whether you have to make a decision based on their impact on the environment or on the costs of this particular anesthetic agent. So you can drill down into each part of this tool to look at the impact of those things you can work on to improve your pathway. And one of the things we've also done on the tool is we can, at the very top of each section, be able to see actively what is the emission factor per patient, what is the carbon intensity per pound per patient, and also what is the cost per patient. And also the same thing, total emission, total carbon intensity per pound, and the total cost of those activities that the patients have gone through. So we have this in each of those sections as well. And after seeing all this, we have scenario portion where you could manage different scenarios across those different sections. So you could create a scenario and try and maybe do a forecast over time and see whether your sustainability plans, they track towards the particular forecast towards 2040, and you track it accordingly on the tool. So, and another thing about this tool is you could also immediately print this. You can print your report easily. I can export PDF and share it with the wider team to say, this is our current status. So you can have your annual carbon plan all done on this tool, ready to go and ready to share with the exec and monitor this in real time, month to month, over time. So I'll stop sharing my screen. That's just a quick demo of the live tool. I'll go back to the presentation before we take questions. And so that's just a brief overview of the Net Zero tool. Then I'll go back to the presentation in a moment. Yeah, so we are with Sheffield Teaching Hospital. We're trying to also map their treat and return pathway for a non-STEMI pathway, which is planned care in across their various district hospitals into the specialist hospital. We're trying to map the treat and return for this particular patient and that pathway and the carbon impact and the outcomes of those patients. All this will be visible on the platform as we try to do this particular case study. And there's been some done already at Newcastle by the Sustainable Health Coalition for the renal pathway, and also for maternity in Oxford, whereby a particular test was done that differentiates patients that are high risk and low risk at the very beginning of their antenatal journey, and they're able to reduce the carbon impact by knowing the high risk better and managing them better innovatively, reducing the carbon impact on number of visits for care during pregnancy. And also for the cancer pathway, colorectal cancer pathway, this was also done whereby an innovative app was given to patients, so 200 patients, and another cohort of patients without the app. And those that had the app had better patient outcome. They also had less hospital visits, which reduced the carbon intensity, but also even the prognosis or the long-term outcomes for those particular conditions. Those that had the innovation uploaded on the particular care pathway had better outcomes in terms of care in that pathway. So the decarbonization objective is not, or net zero objective is not just it's not just for decarbonization, let me put it that way. It is good for the planet, but it is also a strategic advantage for the NHS. So by reinvesting in renewable energy and energy efficiency, trusts can cut their operational costs by up to 10%. and save millions. At the same time, they can boost productivity by as much as 20%, and they can improve, and this is being improving care and patient outcomes, really. And also they can add in better access to capital for green initiatives and a workforce that is highly motivated by sustainability. And by doing that, we have a clear case for making decarbonization a central pillar of NHS strategy. So the benefits are there for the regulators, for NHS, for patients, and of course, having that digital edge as well. And this can only work if we work across organization together as one. And just the last poll, and this last poll just to show where your organization is at the moment in terms of net zero. So based on your current sustainability initiatives in your trust, which net zero maturity level best describes your organization at the moment? I would like all of us to participate in this, just to see where we are we still exploring net zero? Claude, if you can put that in the chat, please. Are we still exploring net zero? Are we still defining net zero? Are we becoming net zero? Or we are being net zero already? I would like everyone to participate in this. Where are we in our organization at this point in time in terms of net zero objective? Are we exploring it? Are we defining it? Are we becoming net zero? And are we being net zero? And I think that will show us the true position of where we are as NHS organizations and what we need to do to achieve that at the moment. Thank you. I should participate. Oh, sorry. I think I pressed on and I ended the poll. Sorry. And I think we can, the results is showing most NHS organizations are currently still defining their net zero position. And I think that is the case. This poll is really just to highlight where each organization stands in terms of net zero journey, really, whether just exploring the concept or already integrating sustainability across operation. So recognizing where you are in terms of your maturity level is essential for planning and setting your targeted actions. So no matter where you are, leveraging the robust green plan, proactive regulation, and digital tools can help you move up the next stage and ultimately achieve a net zero target. So, and these are just the multi-impact benefit of the tool. You have those multi-goal objectives. Like I mentioned earlier, it's not just the decarbonization effect, but also the costs. You're able to see the outcome, population outcome for the patients as well, and also the impact on key emission areas that you may have at your immediate fingertips, and enhanced compliance tracking, and also the actionable insights for you to act immediately. And there are some sequence benefits as well, sequence 5, 8, 9, and 10 for NHS organizations, and also the resource efficiency angle as well. So it's as I said, there are social value measures and there are care delivery measures accordingly. So I just put here a quote from the Sustainability Reporting for the Future from CIMA. Organizations can't manage what they don't measure, and they can't build trust with their stakeholders unless they provide consistent, comparable information on a variety of metrics, including sustainability metrics. So this quote just captures the importance of having monitoring, compliance, and reporting in place for our net zero objective. So thank you very much, everyone. We now open the floor for questions. Now, thank you very much, Elena. Please go ahead.
Thank you for that. I'm sorry if I haven't quite understood this. It sounds like there is an investment needed to do it, to get on the Ardens template. And I am trying to understand whether this is a must do or a good idea because it will give us savings. So could you just clarify, because there is a difference. And I'm sorry if I haven't understood that.
Okay, thank you. I think it's in terms of the net zero objective, decarbonization objective, I think it is a must-do for most NHS organizations to report and make sure they have their annual reporting carbon plans. And secondly, what this tool does for you is to have your carbon plan but not just having your carbon plan, but you're having ongoing, regular monitoring of a carbon plan on a monthly basis, tracked on an enterprise planning platform, looking at what you do, what we do as NHS, which is patient activities, and at the same time looking at your sites, your waste, your gases, your water, your everything. You can be captured on this particular tool. So you have essentially your annual carbon reporting on a tool, and your governance and assurance for your sustainability on a particular platform on a regular basis, and ready to share with your exec and decision makers to make decisions with regards to your net zero objectives and go for the following year, and report annually to the NHS England as well as an organization. And in terms of, to answer the third part of your question, I think you mentioned cost. Yeah, I think it's just more of a license cost and a platform cost, and also maybe the main thing is getting your priority on the tool as well. How do you currently measure what you've got, and how do we get in the bed? We've simplified the benefit of using the tool. All the hard work has been done in terms of measuring what we do as NHS as much as possible, building facilities, procurement, patient activities have been, all these emission factors, default emission have been embedded within the tool with best practices. And so I think what you need is just your activity data for any area you want to measure, and you're able to just get your immediate response. I hope that answers your questions. Ellen, thank you. Or how do we get, I have a question in that says, how do we get access to the tool? If you want to reach out to us, we've got our contact in the chat, and we can discuss further with you, Sarah, if you don't mind. Yeah. Any other questions from Chris? I've got Chris.
Yeah, hi.
Sorry. Hi, Chris.
Hi. Great presentation. Very interesting tool. But one of the things that it feels, from my perspective, working in a community trust, is that if you're going to look at the cost of the holistic carbon cost of a patient pathway, it feels like it would be a better tool for an ICB or an ICS to engage in as a whole to see the full benefit. Because if you look at you showed a block diagram on the bottom of one of your previous slides where I think the output was community trust and community care or something. Go back. Sorry.
I'm trying to.
Yeah, I know you're trying to find it.
Yeah, I'll find it for you.
There's so many slides, but the amount of impact that's the one, isn't it? Where you've got the kind of continuing or the community care. So as a community care provider in the bigger picture, potentially the carbon difference that we would make by purchasing this tool for one and putting our input into it would be relatively small. But if it was a system tool within an ICB or an ICS, and then everybody could contribute, I know it doesn't make as much money for you, sorry. Contribute their components, shall we say, it would give a much more holistic picture. Because I've just come off an ERIC meeting, and ERIC captures a whole bunch of data across trust, and that's a statutory mandatory statutory obligation. This is a voluntary thing to try and support organisations. But it's interesting and it's well thought out. But I don't think as a community trust we would get the full benefit from it in terms of making the NHS greener.
Yeah, I think for the community trust, I think what we have is, for example, in the community, there's a little piece of work that we had going on, because how we built the tool is work at a system level and move down to organization, down even to department level, depending what you want to measure. We have that top down and also horizontal approach to the way we've designed the tool. And secondly, I think one of the things, we've looked at this in the, I think this will be powerful in the community as a complaint. What we've done is there's a particular piece of work that was done, I think, around Norfolk, whereby they've optimized the district nurses' visits via artificial intelligence, planning their scheduled routes. And they've been able to optimize their journey, that they're able to see more patients. So there's all those savings being get, they're able to see more patients. At the same time, the carbon output was also reduced massively, and the savings in terms of efficiency and maybe less, maybe wastage or some visits to some clients was also about 5 million in annual savings was realized from using that tool, and also that's just excluding the decarbonization effect as well. So I think this is a massive tool that works in the community as well, and people in the community have looked at this in terms of even what they use, the resources that they use in the community. For example, gauze, that the nurses use in the patient's homes. They've measured the impact of how can we use less of these resources following good clinical practices, and they're able to track the costs even of these gauze on a monthly basis and reduce their waste. So I think there are different ways you can apply this within your particular organization. I think it's just taking those initial steps and to reach the whole system. I think we're able to cover everywhere, but in the community, this is particularly impactful in the community as well.
Did I hear you correctly? And you said about nurses in Norfolk community. Was that correct, or did I mishear you?
Yes. Norfolk. There's a Norfolk. I'm happy to share with you after I don't have it ready to hand now, but happy to get in. If you could get in touch with us, I could just show you the study that was done. If
that's NCH and C, I already have contacts with there. So if it is at Norfolk Community and Healthcare Trust and their district nurses, then I've got to weigh in on that one.
Weigh in on that. Okay. Yeah. Let's catch up later. I can share that more with you. Yeah. Thank you. We had I think we had another hand up. Was it Jasmine? Yeah.
Sorry, yeah, that was mine. Chris sort of asked my question for me. My main thoughts around it were just in terms of collecting the data and capacity. So we don't have a designated sort of sustainability team. So it'd be quite difficult for, unless I've misunderstood how the tool would work, I'm not sure how sort of one person would be able to input all of the information that would be required to get a full capture. So I sort of echo Chris's thoughts on it being more beneficial maybe from an ICB perspective, with dedicated teams for this sort of thing.
Yeah, that's right. That's a very good question. And when we're building the tool, we had the end user in mind as well. Like I mentioned earlier, I think what we've done is we've done it in such a way it takes minimal effort from the end user. And I think what we need to articulate, what we normally do or what takes time to do initially is, what do you really want to measure in your trust or in your organization? After getting that particular, the next question is it on the tool already, inbuilt already, or is this something we have to actually do the actual default carbon factor for you on the tool? Then you're able to track it by putting your number. For example, looking at the treat and return that pathway that we're currently doing with the Sheffield Teaching Hospital. All we required for them is after telling the clinical team, their involvement was just maybe, I don't know how long it took them to map up their own clinical pathway, but all they did was provide us that particular clinical pathway, and we're able to map it to the data points on the tool. And we just told them, oh, we need data for this particular spot. So we're able to give them, can you provide data for this particular spot as much as possible? And they were able to, because it was their own pathway and they gave it to us, they were able to provide data for the number of patients that came into that service, and also maybe the successful treatment, the journeys that they took back and forth. So we're able to track that on a monthly basis. They had that data available.
So it doesn't necessarily...
Yeah.
Sorry, just to follow up, it doesn't necessarily require the end user to have specific carbon literacy skills. It requires them just to have sort of the base data for number of purchases in a specific area. Okay, cool.
Fantastic. It doesn't require any carbon literacy. Yeah, thank you. Any further questions? I think our time is up. If there are no further questions, so we're happy to, if you have questions, we got the contact in the chat. please feel free to reach out to us. We can discuss more about it. So if you are looking to implement this in your local pathway, your organization, or you're looking to capture your annual carbon reporting plan on a platform that is just ready for the organizations to use, we're happy to make sure you have that as well. So on that note, I will say thank you to everyone for joining us on this webinar today. Thank you.
Thank you.
Thank you, everyone.